This is dedicated to all my beautiful queens, all my beautiful ladies out there. She's a queen. Go queen. You got it, girl. She's a queen. You better represent. Go queen. Go queen. Go. She's a queen about her business. Queen. Working hard on a mission. Yeah. Head high, purpose driven. Purpose driven. Crown on never tilted. Go queen, go queen, go queen, go. Represent, you're a queen, oh.
So thank you all for joining the Q Chat, the conversation amongst queens. My guest today is America's favorite nurse. Her name is Nurse Alice. And Nurse Alice's platform is educating and empowering people to take control of their health, wellness, and lifestyle. She's a family nurse practitioner, author, educator, and speaker. So I'm very happy to speak with her today. We're going to be talking about some things that are really pertinent with our community, with our health and cardiovascular health, and how we can just live healthier, safer lifestyles. How are you doing today?
I'm doing fine. Thank you so much for having me. I'm really excited to talk to you and talk to all your viewers.
Awesome, awesome. So I know that one of your platforms is cardiovascular health. And I know within our community, that is a huge thing right now. Just a lot of people of color are having heart attacks, and that age is starting to get younger and younger, actually. I know people personally in their early 40s that have passed away from heart attacks. What is some of the things right now that you think are some of the biggest misconceptions on how we can prevent heart disease in our community?
Well, I think one of the misconceptions is that people think that heart attacks are for people who are older, and that, although we've seen younger people experience or heart attacks or dying of heart attacks, they think that it's an anomaly. And it's really important for people to understand that even if you are eating the healthiest, you're exercising well, you're not smoking, all those things, our body naturally, because of the aging process, goes through changes. And some of these changes include a buildup of plaque in our arteries. So even if you're living the best life, you still can be predisposed to having a heart attack. It's these other things that we do. It's the not eating right, not exercising well, the smoking, the not getting enough sleep, which actually can exacerbate people having sooner heart attacks, more events. And that's what we've been seeing because of the lifestyle that is now available to us. I think people are moving fast, social media, more sedentary, we have access to more things. And it's those lifestyle changes, if we're not careful, can contribute to high blood pressure, diabetes, the weight gain, and all of those things that puts us at risk for a heart attack. I think people, they hear the word heart attack or heart disease and they think, well, nothing's wrong with my heart. My heart is feeling fine, but it's actually a slow buildup of things. So if that's why lifestyle changes are so important. If you make a lifestyle change, things start to improve that day, but it's really something that needs to be maintained. It's not, oh, I'm just going to eat fine and be healthy this week, and then I'm just going to do whatever the rest of the month. It doesn't work that way. And so one of the misconceptions is I don't, oh, these things aren't really going to matter. Like if I do this, it's, if I change what I eat, it's not really going to matter, but it really, really does. I like to tell people, and my mantra is I like to talk to people before they become my patients. Because as a nurse practitioner in the emergency room, if we're meeting, like not in this environment, like I'm so glad to have met you, but you're not meeting me in my emergency room. You're not
Yeah.
actively having an issue. So I like to talk to people about that and all the things that they can do to stay healthy. And it is making healthier food choices. It is being more active. Now, you don't have to go to a gym. You can sit and dance in front of the mirror to your favorite songs for 30 minutes. It's getting appropriate sleep, being mindful of the substances we're exposing ourselves to, whether that's alcohol. And, it's okay to celebrate with an adult beverage here or there, just not chronically. And then smoking, that's another issue. And then just maintaining our wellness with our annual visits. Those are things that don't seem like, oh, that's not going to make a big difference, but they actually do. Collectively, they do, and especially over time, because, something that we do every day, every week, for months, for years, can really make a change. And those making subtle changes can really make an impact on not only your quantity of life, but your quality of life as well.
Yeah, that's a very good thing saying the quantity, the quality, not just the quantity. Right now, it seems like I know, like we live in a society, I think now where we kind of push living a fast lifestyle. There's some entrepreneurs that even kind of pride themselves on saying like not sleeping, which sleep is obviously a huge factor. It's something that we really need. We need to get 8 hours of sleep. We need to be more mindful of what we eat. And also, I know you also mentioned the gym. I think some people with fitness, they think that you have to go full blown, join a gym, do a lot of extreme exercises to be healthy, but you can also start small. One thing, too, that I wanted to ask you, does it seem like there is a disparaging like numbers as far as people of color having heart attacks as opposed to our counterparts?
Absolutely. So if we look at the United States as a whole, every year, almost 700,000 people die of heart disease. So that's about 1 in every 5 deaths is related to heart disease. But even more so when it comes to African American community, we're 30% more likely to die of heart disease than our white counterparts. And, and that really should not be. But because of, and I'll go ahead and say this, there's still deeply rooted historical racism in our healthcare. I mean, how and I don't know if you've experienced this, but even myself, I've experienced it and even seen it in my family and my friends. And actually, if I could tell just a quick story, my dad was my inspiration for wanting to become a nurse. Um, he had high blood pressure. He had experienced heart attacks and strokes. And as the eldest, I helped to take care of him. So I was in his business about health uh, issues. And I just saw that he didn't get the same community outreach, education services, offering of things um, as some of our white counterparts. And, the neighborhood we lived in, this was the closest hospital. This is where we got care. And it was almost like a perpetuating cycle. If we don't have access to good quality health care, if the providers don't step up and do everything to offer services and treatments to us, then how can we really get ahead and switch things up? Because why are we 30% more likely to die from a heart attack? Well, probably because there's not as the access of healthcare, quality of healthcare, how many providers, we're limited providers that work in our communities of color, and things like that really make a difference in the type of care that we receive. So my dad inspired me to become a healthcare provider, nurse practitioner, so I can actually set my journey out to be the best cardiac nurse in the world, so I could give back to the community. And I've done so in so many ways outside of just work, but with the NAACP, National Urban League, American Heart, AARP, to get out into the communities and the churches to talk to people about the things that they can do to improve their health, especially in communities of colors, because there's also mistrust. We know there's implicit bias that exists in healthcare. There's also medical gaslighting that happens. There's studies that show that people of color, we come into the emergency room and complain about I'm having pain, versus us getting worked up for a heart attack or things like that. The question there's a thought process that comes up: are they drug seeking? Why I have to be drug seeking? I'm having pain. Just because a white man comes in and they have pain, and you're working them up this way, but if I, as a black woman, come in and say I'm having pain, either it's dismissed like, oh, it's just anxiety, it's just this, it's just that, or I'm drug seeking. It just unfortunately, these things still do happen in our healthcare systems today. Not everywhere, but it's still prevalent.
I'm so happy you mentioned that because it is true. I've definitely experienced that personally. I just recently had surgery in January and I delayed it for a year because I didn't trust what my doctor was telling me, actually, or I just wasn't 100% confident because we do know that people of color, I think we all have this silent feeling that when we talk to the doctor, and I'm not saying everyone has this feeling, but I think a lot of us have experienced when we talk to a doctor, sometimes we don't feel like they're truly listening to us. Or even if they're listening, it's like, okay, do you really truly care that I'm not feeling well or that I'm sick? Or if you want to cut me open, do you really have this desire to keep me alive. And I know it's kind of terrible to say, but you're right. It's a historical thing where we don't necessarily trust the doctor. And that's something I actually was planning to ask you too. Just what can we do to curb that though? Because we obviously need to take care of ourselves. We have to go to the doctor. We do definitely need to have a primary care physician that we trust and see that primary care physician on regular visits, get our blood drawn, get our blood pressure taken, discuss anything that's not feeling well that we can work on. But how do we curb that feeling? Because a lot of people of color aren't comfortable finding a doctor that they feel like they can trust. And as you said, especially going to the emergency room, it is a hit or a miss for a lot of us. So,
Yes.
what can we do to curb that? Because we do need to take care of ourselves. And it's just some people, I think, that fear, that distrust may prevent them from getting help altogether, which isn't the best choice either, but it's understandable why a person would have any fear. So, what can we do to curb that?
So I first want to say your antennas are peaked for a reason. So if you're feeling that reason, that is a red flag that maybe you need to evaluate the situation with your provider. So yes, we all need to go, get our annual checkup appointments. Some of us may have things that are brewing that need follow up, treatment, intervention, and you want to be able to trust your provider. You absolutely do. And sometimes, many times, and I've had patients ask me all the time, because I'm in the emergency room. So you're seeing me like as needed in emergency if you can't get to your primary provider or if it's serious. But they'll ask me, do you know a Black cardiologist? Do you know a Black primary doctor? Like, do you, because you want to go in, you want you want your provider to be able to listen to you, but do you hear me? Like, do you hear me? Do you understand like my struggle, my problem, what I'm going through? Like, are you aware of what you're saying to me? Because, like, I'll use an example. Like during the pandemic, we told people social distance, 6 feet away, this, and that. Well, how you tell a family of six that live in a 2-bedroom apartment that you guys got a social distance? Like, are you understanding the circumstances and the external factors that impact my health? Because while you might be there to say, oh, I'm having like my heart's bothering me, I have these palpitations and things like that. Are you understanding that I live in a neighborhood that we don't always have access to fresh fruits and vegetables? You see my insurance, you know what kind of, you may have an indication of what kind of money or services I'm able to get. You know that, do you understand that in my neighborhood I can go out and exercise at night because it's dangerous? Like, you want a provider who's really going to not just listen to what the words coming out of your mouth, but look at you in the big full picture, because healthcare should be keeping us healthy. But unfortunately, it's almost like sick care. More people come in when they're sick to get care than they do when they're healthy and trying to stay well. But when it comes to selecting a provider, you want it to be someone that you trust. So I know sometimes insurance will say, well, pick from this list of doctors or nurse practitioners, and you can go, and let's say you don't have you don't feel like your provider is listening to you. You don't feel like you can trust them. If you feel comfortable, which I encourage people to do, because really you're the boss, they work for you. If you're not there, they don't have anything to do. I would, explain to them, say, you know what, I'm feeling uncomfortable because it's my body, it's very personal. I'm sure you deal with this all the time, but I want to make sure that as, an African American woman, that as I'm coming to you with issues, that you feel okay and comfortable to consider the external factors that might be influencing my health, like where I work, where I go to school, and, things like that. Because historically, we'll say deeply rooted historical racism, but the truth is some of us have had recent bad experiences with healthcare providers, and that's why we don't trust. But have a conversation with your provider. If you feel like they're still not getting it, you still don't feel comfortable, you should never feel like you're going to the principal's office or you can't tell the full story with your provider. If you do, that's the wrong one, and you need to interview someone else. Now, would you stay in a bad relationship with someone who didn't treat you well? Right? No. If you're not going to choose a partner like that, you shouldn't choose a doctor like that. So it may seem like an inconvenience, but perhaps you need to find another provider to take care of you. Now, I understand that's not always possible in all the cases, because you're like, this is the only one that my insurance covers, and la 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 la, and this is it, Nurse Alice. I don't really have a choice. Well, that's when you really need to, have a conversation with your provider, and then also about let's say you're coming in there for a health issue or heart issue, talking to them about your feelings. And if they automatically jump to a surgery or automatically jump to this treatment, ask the question, say, is that the only thing I can do? What are the other options? Even if you don't feel like I should do, even though you feel like I should do this, I want to know what the other options are and why I can't do those. What are the least invasive things I can do? Like, you want to jump to surgery. Well, is there any type of treatment, or is there a lifestyle change I can make? Like, talk to me through those things, because I don't believe that all providers take the time to walk their patients through all of their different options. They just exert their expert opinion and expect for you to do it because that's what the doctor said. And we're of the day and age where I like options. Tell me my options and let me select. And that's how we create a partnership. Your healthcare provider should be your partner, not someone who tells you what to do, but someone who listens, like one of your girlfriends, almost listening to what you're saying and helps you come up with a plan that is okay with you, because it's ultimately, at the end of the day, it's about your goals and what you want for yourself, not about what they want.
Right, right. Well, you hit a lot. And I agree, because I know even in my personal situation, the doctor that did my surgery, and I don't dislike him, but I pushed it off for a year when I was supposed to first have it. He does this all the time. He always performs these surgeries. I, on the other hand, have never had someone cut into my abdomen. So I was just like, I just wasn't comfortable and I pushed it off. Now, once I realized after months of suffering, like I have to get this done, I still felt like all my questions wasn't answered. It took a nurse actually during the pre-op to answer everything and explain to me, hey, we do EKGs. If you don't pass the EKG, we will not be doing the surgery. Like, just everything that she said really eased my mind. And I think that's one of the many reasons and disconnects sometimes why people don't take care of themselves. Because you can even have a doctor with the right intentions, but sometimes they just don't necessarily have, as the old school would say, the bedside manner to know how to get down to their patient's level and explain things to make them comfortable. Sometimes it's just too textbook in a sense to make a person understand under their terms. Hey, maybe this is why you need this procedure. Like you said, sometimes they're not really giving you a lot of options, or you feel like there's no other option and you're just simply not comfortable. So I think there's a lot of disconnects. But as you mentioned, as we all know, we have to go to the doctor. So I think that's the thing that is a struggle for many people, because there's so many people, like I said, I personally know people in their early 40s who have passed away. They had medical issues that they just really weren't taken care of. And in your mind, you think, oh, well, I'm young, but it's not the case anymore. We have to truly take care of ourselves. So we have to work through those fears. And like you said, there's always other options. There's different doctors. If you're not comfortable, sometimes you do have to just speak up, find another one, even if there's some things with your insurance, you just may have to take some extra steps, but we all should have that right to have proper health care. So one thing I wanted to talk about and just dive into regarding women of color, there are certain health issues that are specific to us. And I know we mentioned cardiovascular health, women of color. We do deal with that as well, of course. And there's also, as I just went through, just the issue with fibroids, which is something that a lot of women of color are dealing with. What are some of the typical issues that you see that are pertinent, that are just something that it seems like women of color are specifically dealing with?
Well, you hit the nail on the head when you talked about fibroids. About 80% of Black women will experience fibroids throughout their lifetime. I've actually experienced that as well. And I've had 2 surgeries to remove them. And unfortunately, some of the things about fibroids is that they can come back, they can grow. It's just one of those things. But Black women, we suffer, it seems, worse cases of fibroids. And although I said that I had 2 previous surgeries around fibroids, Black women, when they experience fibroids, and historically, and there's data to show this, that the immediate treatment is, oh, would you like a hysterectomy? It's like, whoa, 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 slow down.
Yeah.
You want, my cycle is a little heavy. I have some pain, but hold on, you want to take it all out? And so, and that's one of the things, and what instills fear in going to providers sometimes. You want to know what your options are, or at least explain to me why you feel like we got to go to this major extreme instead of having a surgery where you just take out that small portion, those fibroids out and leave the rest of my uterus intact. But hands down, Black women, unfortunately, fibroids, heart disease, diabetes, those are some things that I see commonly with Black women, and even some of the more serious conditions, like when it comes to breast cancer, and issues with their kidneys. This is where, and I love being a healthcare professional. I love taking care of people, and it's one of my passions. I go out in the community, I preemptively talk to people to take better care of themselves and do screenings, early identification, early treatment, so we can catch something sooner before later. But when we don't have a good experience with our healthcare provider, when we put off procedures, we put off surgeries and things like that, when you finally do get to the point where you go in and get care, problems could be worse. And I will say this, when it comes to Black women especially, and it comes to treatment, while mind you, there are several barriers that gets in the way, because your doctor's visit is like banker's hour. So if you're someone who got to work and can't get the day off, it's hard for you to get into the appointments. Sometimes that quality or access to that doctor, or how to navigate insurance, all of those things, there are lots of barriers. But when you get there, it's really important to do all of your screenings, because when it comes to Black women, like with kidney, I'll just use like kidney issues or kidney disease. By the time most Black women get diagnosed with kidney disease, they're a lot further advanced in their kidney disease than white women. And I'm going to share this. And this is some things that people don't know, why you have to have talks with your healthcare provider. When it comes to equity in healthcare, right? We feel like people say, oh, well, everyone has access to a doctor. You can go to a doctor. Everybody has access to healthcare insurance nowadays, right? Most places, not all places. But the actual healthcare system itself, some people may not know, and I'll give two examples. Kidney disease. There's actually a particular value. It's called glomerular filtration rate, GFR. You don't need to memorize that, but it tells us where you are in your kidneys health. Mm-hmm. There are actually two scales, one for Black people, none for non-Black people. So in order for a Black person to qualify for the criteria to be diagnosed for kidney disease, the number is a lot lower than a white person. So meaning a white person will get diagnosed with kidney disease before a Black person will. So that means that, and that goes along kind of historically where they thought, oh, Black people, because of the melanin in their skin, they're less likely to feel pain. They're less like, all of these erroneous, stereotypical, racist thoughts that were in medicine before. Oh, Black people, they don't experience pain like white people, so we don't need to give them pain medicine. I know, that's upsetting. But back to the kidney example. White people will get diagnosed with kidney disease before a Black person will. So no wonder a Black person gets diagnosed with kidney disease. All of a sudden, they're jumping to dialysis because we can't do nothing else to prevent. We missed the boat of prevention because they didn't get diagnosed. And also things like HPV, right? We've heard how HPV can cause cervical cancer and things like that. And there are vaccines, the HPV vaccine, but there are several strains of HPV. Did you know that the vaccine that we currently administer are for the most prevalent HPV vaccines in white people, not Black people? The HPV strains that are most prevalent in Black people are not protected within that vaccine. So yes, you got to go to your doctor, be seen, and do everything you can, but understand that the healthcare system is still, unfortunately, still wired and geared for, not geared for the Black person, the Black experience. So we have to be even more diligent about our health and, curious, ask questions. We have to hold our healthcare providers accountable for giving us information that is specific to me, not just, oh, studies show this, yes, but okay, but what does it say about Black women? I get you did 5,000, 10,000 people in the study. What does it say about Black women? Because that's what I need to know for you to take good care of me. And I'll be honest, these aren't the questions that you're thinking of when you go to the doctor. You're thinking about just expressing what your concern is and hoping that provider is going to be able to know what to do. And this is where we have to hold providers accountable for these things and making sure that they are doing things that are specific to me as a Black woman.
Wow. And, I think a lot of people, Black women in particular, because I heard this analogy recently, which I I can see the truth in it. It was saying that a doctor is to a black woman as a police is to a black man. And I never thought about that until I had to really evaluate some personal experiences I've had at the doctor and just stories that I've heard from other people. I know one situation in particular because I've always had anemia. And same thing, some doctors, and I did recently have a hysterectomy, but I even questioned to someone, I'm like, I wonder did they just tell all black women to have hysterectomies. Now, mind you, my case was pretty severe. So even then, I still waited because I'm like, I still need to be comfortable first. But long story short, it was a hematologist I was speaking with, and she just immediately was just very rude. This was in Louisiana. And she's like, well, you're never going to have your iron where it should be until you just have a hysterectomy. And she like dismissed me, and I had waited for the longest for that hematology appointment. And I was like, well, do you think I can just talk to my gynecologist and just have the hysterectomy next week? I can barely walk, and I just was so angry. And I remember calling my primary care physician on the way home because they were the ones that arranged the appointment. And I told the nurse over the phone as I was complaining, I said, this is why there's disparities in the treatment that women of color get from the doctor. And this was a young white nurse, obviously. So I know she was extremely taken aback when I told her that, but they don't understand. So again, it's true. I know I've personally been in those situations where you're at the doctor and you're asking someone else, hey, do you know like a black doctor, that specializes in this? Because it's a comfort level. We want to see more people of color in that white coat. It just makes you more comfortable. I never forget when I had my last child, I went to the emergency room to triage a week prior. He wasn't due until December. This was before Thanksgiving. I was like, something's wrong. He's not moving as much. Same thing. The nurse dismissed me. Oh, well, you are approaching your 9th month. I had my son a few days later. During the delivery, his heart rate kept dropping. And during that particular pregnancy, it was really rough. And I had a white doctor at the time he delivered the other two, but he just was so different in his third pregnancy, more busier. He had more titles. And I remember two black nurses, one of them took my blood pressure. And she looked at the number and she showed it to the other nurse. And she's like, something's wrong, take it again. Long story short, 3 times they took my blood pressure. The third time they took it, they both looked at each other and they looked at me. They're like, are you feeling okay? I was like, I've been really exhausted during this pregnancy. And they were like, look, these numbers are entirely too low. Have you talked to your doctor? I said, well, I've told him. They said, look, if he's not listening, you need to get another doctor. I listened to those two black nurses and I got a black obstetrician during that pregnancy. Long story short, the baby ends up coming early anyway. That same black doctor, she just happened to be out of town that weekend. So many women of color were in the hospital that weekend that they were like, I was like, are you going to be on shift, this whole evening? They were like, yeah. So I was like, you know what? I'm fine if she can't make it because she had went out of town and I really have formed a bond with her. So she was really upset that the baby came early. But I was like, you know what? If you're going to be on shift, because it was all young women of color, the anesthesiologist, the doctor on call, the nurses. I was like, wow, this is like heaven. So I was like, you can tell her she's her trip. I'll see her, after I have the baby. It's completely fine. And when I had my son, the heart rate kept dropping that whole delivery. The nurses were awesome. They kept coming in, keeping me calm, not letting me know how serious that really was. When I did finally give birth, he had a knot in his umbilical cord. And to this day, and that same son is almost 15, but to this day, I still think about that nurse that dismissed me in the triage. I'm like, I could have lost my child. So I just think we all have unfortunate stories where we just didn't feel like we were listened to or valued. And sometimes the story doesn't have a satisfying ending. And I just think that's really unfortunate. So I had to get that story out. You were mentioning these things because
I'm glad you shared it.
I'm sorry.
I said, I'm so glad you share that because that is actually the medical gaslighting that I was mentioning earlier. It's when your concerns about your health go dismissed, they're not heard, or they're minimized. And unfortunately, Black women experience this at so much of a higher degree than anyone else. And we've seen the news headlines and stories about maternal deaths and, Black women dying and our Black infants dying at way higher rates than anybody else in the United States, where we have all the science and technology. And so I'm sorry that happened to you, but I'm glad that there were other healthcare providers who were vigilant and who, stepped up, stood in, said something to you, and empowered you. And it's that type of empowerment that I hope that I provide for other people. So I know, people say America's favorite nurse. Where'd that come from? I literally didn't give myself that name, but those same nurses, I'm sure they're Louisiana's favorite nurses, whatever the case may be. But when you have someone who's really passionate about healthcare, we advocate. We advocate for people, and especially being a Black woman, I know what it's like. I don't even tell people I'm a healthcare provider. I'm like, let me see what you're gonna do first, and then we'll see how it goes. But to prevent stuff like that from happening, I mean, obviously, I wish I knew an exact, absolute answer for that. But maybe a good icebreaker is when you meet a provider, which I know you were extremely disappointed with that hematologist. I was disappointed for you when you said the story about how you're waiting for this appointment and then to get there and have such a poor interaction, poor communication, just like, do you even care? Do you care about your patients? Because that's what it leaves you feeling like. But maybe a good icebreaker is, as you're exploring things and saying, this is my first time, being with you, your first time meeting me. We're going to learn so much about each other. And you can blame, I was doing some research and reviewing, and I know that you're a specialist and appointments are very difficult to get with you. So my time with you is very important. So I'm hopeful, and you can let me know that if you can confirm this, that every time that I come, that you are really going to listen to my concerns, because I've been reading a lot about medical gaslighting, and I hope that you're not that provider. But this is my first time meeting with you, so I just want to put it on the table. So we got to call people out on their stuff. It's no easy way to have a difficult conversation, but your health, this is your livelihood. You said that you could barely walk. I mean, that's significant. So we got to really hold people's feet to the fire. You're the doctor, you're the nurse, you're going to be taking care of me. Okay. I need you to do what you're supposed to do, and don't just dismiss me or just write me off somewhere, because the one time you write someone off, that could be the serious case where something's happening. And unfortunately, those are the stories that make the news.
Yes. And that's the scary thing, because the thing about it too is not everyone is educated and able to articulate themselves, and they deserve the same type of care. So like I said, there's so many different chapters to that story on how people aren't receiving the care that they deserve, from different economical, educational standpoints. Everyone deserves to have the same type of health care, and again, that's why I just think it's so important to have people of color. And again, like I said, my son with that story is 14 years old, almost 15, but I'll never forget those two nurses of color that were just honest with me. They were like, if he's not understanding what we're seeing just by taking your blood pressure, because it's extremely low, you need to get another doctor. Like, they didn't sugarcoat it. They looked at me like something was wrong before they asked me, are you okay? Are you feeling okay? Because they're like, there's no way you're feeling okay with this low blood pressure that we're seeing. And they were serious. They're like, you need to get another doctor if he's not going to listen or treat this. And I did make a point to listen to them. And I never forgot that. And I always tell that story whenever I'm discussing, with other people, just certain instances they've had at the doctor. Again, nurses really, they're so special in general, because they just really, I'm not saying that doctors don't take the time to speak to people, but I just think a lot of people have positive stories about a nurse, that made them feel comfortable or made them feel loved or just made them seem like, okay, someone's here. So that's a special thing about nurses for sure. So one thing I want to ask you as well, being a person of color that's in the medical profession, have you faced any particular challenges? I mean, obviously, different things that we deal with as patients, but in your journey in your profession, have you faced any challenges as a woman of color in the medical field?
Absolutely, all the time. Uh, and I'll say this, when it comes to Black nurses in the profession, it's barely 9% of nurses are Black. And don't quote me on the physicians, but when it comes to Black physicians, even less. I want to say like 5 or 6% of physicians are Black. And so as a healthcare provider, it's an interesting thing, because Some people say, Alex, you know, like I move a little bit slow. I don't move slow. I'm just complete with the patient care that I provide. I would rather provide complete patient care to 10 people than you just zipping through, getting people in and out, in and out, in and out. And okay, yeah, you saw 15, but did you really see 15 people? Or did you just kind of check the box? So I pride myself whenever someone comes into the emergency room or that I really am listening to them. And I'll talk about, I make it a point to speak to them in their primary language with a translator, making sure I'm getting the full story. I'm asking about I'm thinking about everything that contributes to this, because I'll also say this. Many people that I see in the emergency room don't have health care. And because of that, they access the emergency room. So while you're here for this one issue, I'm still kind of low key going through everything else to see, like, okay, what else do they need? Because I know they don't have insurance and there might be something brewing that I need to help them with. And this, Alice, this is your one shot to help this person. What happens here could really send them on a trajectory of a life to wellness or a life where they're going to be sick, get really sick. So I get pushback sometimes from like the higher ups. Alice, we need to see more patients. We need to get people moving through. Okay, that is true, because healthcare is a business. I'm just going to have a transparent moment. Healthcare is a business. So there's that financial component, efficiency, and things like that. But what value do you put on somebody's life? What value? And then I have to remind people at the hospital, I'm like, my father died in an emergency room, probably because of practices like what y'all trying to have me do, trying to rush people through this emergency room. You know, these people don't have insurance. You know, this and that. You don't catch the wrong one. You think the patients that are coming through here are maybe you think they're uneducated. They don't have insurance. You want to just get them in, get them out. That's not what we should be thinking about. We should be thinking about how to keep this well, people well. These are people of the community. If we don't have a healthy community, physically, mentally, we cannot have a healthy community economically. We have to think about how the things that affect us physically and mentally impact all other aspects of our life. So as a healthcare provider, I'm pushing back on some of the insurance companies. They want to deny stuff, like you got to send authorization. What you mean? Let me get in here. Say this, say that. I really advocate for patients, and if I can't do it, I'm going to find a way to do it. Because just as much as they put the system is structured a certain way that really isn't to our benefit, you talking to a black woman. You talking to a black woman whose father died in the emergency room. I bet you I find a way. I bet you I can find a way for my patients to get the services that they need, even if they're not going to receive them here. So that's one pushback that I get pushback on that, but I'm okay with that. You know what? I'll take that. That is such a small price to pay, or, you know, compared to the impact that I know I need to make on my community. I know what it's like to grow up in a underserved, poor community. I get it. I know what it's like. And I'll say this, although people will say, oh, everyone has access to healthcare, but do we all have access to quality healthcare? And that's what I'm advocating for, and that's what I push for. But I just see discrepancy. I see things that happen at work. I'll see other providers, and I poke my nose in. And again, that's why say, "Oh, America's favorite nurse." Yeah, because I'm gonna step in, I'm gonna poke my nose, and I'm gonna advocate, because that's what I do. That's what I do as a nurse. I need to advocate, just like those two nurses that were telling you need to find another doctor. Well, I'm gonna tell you you need another doctor, but I'm gonna go to that doctor, especially as a healthcare provider. I'm gonna go to the doctor like, look, you slipping here. This lady's blood pressure is this and that. Did you do this? Did you do that? And I step on some toes, but listen, at the end of the day, everyone's life is valuable, important, and I can't place a dollar amount on it. Insurance might try to place a dollar amount on a procedure, a medication, or this, but this person's life is so much more valuable.
Mm-hmm. Yes, yes, yes. Thank God that they have someone like you to advocate. And it's really a shame that your passion came from a tragedy. But again, at least you're in there that you can prevent this from happening to someone else. So that's a blessing in itself. I wanted to shift a little bit and ask you just about self love. I do talk about self love a lot. Self love really is the fuel for us to know that we deserve better, for us to even recognize, hey, I need to take control of my health. So, what role has self love played in your life, just with your aspirations, just with you being an advocate for other people? And it's just such a great thing that you're doing, and it's definitely something to not take lightly because, again, nurses really are the heart to the medical field, in my opinion. Nurses really are the ones that nurture, they recognize things, and they do a good nurse, of course, shows that they truly care. So, what role has self love played in your life, and the important role that you're playing in so many other people's lives?
That is such an interesting question. And even though, like, I'm the guest on your show, I'm the health expert, I'm supposed to know it all. I'll be honest, I can think back to moments in my life where I did not exercise self love. I think we've all had times in our lives where things didn't go as expected. We were disappointed. We were let go from a job. Maybe you had, experienced a divorce or a breakup with long term relationship or a partner. And hindsight's always 2020, right? So you go back and look, you're like, what was I going through? What was I doing? And I recognize that I wasn't doing all of the things that I needed to do to make myself feel whole and complete and healthy. And when I say healthy, I don't mean just physically, but mentally, spiritually, and emotionally. So when I think of self-love, all of the things that you do to practice self-love really is what you need to be happy. For someone to be happy, there has to be a component of self-love. I don't think you can have one without the other. And I think to really love yourself, and it's not just loving myself like, oh, I'm cute today, that kind of girl, like that. But I'm talking about self-love and happiness, meaning physically. I'm all cut up. I'm taking care of my physical vessel, right? This the shell of Alice. I'm taking care of that. Um, I'm being mindful of what I'm consuming, taking care of it. I'm taking just as much as you would take care of your most precious diamond ring or your car. I'm putting that much care and effort into protecting myself physically and then mentally also. And I do see a therapist, and I think people should see therapists, just like you go for your annual appointment, annual checkup. You should have be proactive in your wellness care. I make sure I see a therapist, and then I
Mhm.
take the time for myself to kind of recharge myself and reevaluate what am I doing, am I passionate about this? Is it leaving me full? Am I happy? Am I exercising in my gifts and my passion? Am I here serving the purpose that I was placed here to do? And I think when I look at all of those things and they intersect, that's where self-love is and that's where happiness is. And I wasn't always there. And sometimes I, backslide a little bit, but I got to reframe my mind. So mindset's also important for that. But it takes a village. I surround myself with people who can feed and support a positive experience in my life. And I think you need all of those things for self love. And it's not as easy as what it looks like on Instagram. Hashtag self love, hashtag elevate, hashtag all that. It's more than hashtags, y'all. Y'all got to do the action. There's action behind that, but it's so worth it. And though that is what I believe leads to true success in life.
Mm. Wow. And I agree with everything that you said. I definitely believe that mental health is also the silent partner in our health
Hmm.
because as you mentioned, I've said this as well, as least we should be having those regular annual physical checkups, we also need to check on our mental status. So we definitely should practice speaking to a therapist on a regular basis. This is it's very important. It ties into everything. A lot of times things lead to depression that we're not even aware of. Vitamin D
Right.
deficiency can lead to depression.
Yeah.
So everything ties together. It's all a marriage. So it's so important for us, especially women of color. Go see that primary care physician. If you have one you don't trust, take the time, do some research, ask a friend, hey, do you have a doctor that you like? Do you have
Yeah.
someone you can recommend? Get that doctor and find a therapist too that you're comfortable with, that you can express yourself, that truly values you and understands you. Before we end everything, I want to ask you, can you give us some signs, telltale signs that we should be aware of that could possibly be signs of a heart attack? And the reason I wanted to ask you that is because that I wanted to end with that question is because, as I mentioned personally, I do know a lot of people in their 40s who have passed away from heart attacks, and it's just something that I think is a scary thing once you hit 40, when you realize that there's some people in our age bracket that have passed away from heart attacks. Because I think in the past, the stigma was, you thought, the misconception was, we always thought it's older people that passed away. But we're seeing now
Mhm.
that no, there are people in their 40s that have passed away from heart attacks. So can you give us some signs maybe to look out for? Because I've read a few things about maybe if you have like a pain in your jaw, things like that. Can you give us some signs that we can look out for that would be signs of a heart attack?
Yes, so some general signs that one might be having a heart attack. There's that kind of classic chest pressure, chest pain, or you feel like there's a band on your chest and it's really tightening you, and it can almost feel like you can't breathe, and just this pressure. And the pressure will sometimes go into your neck and into your shoulder. So those are some of the most classic signs that someone might be having a heart attack. However, research has shown us that women can present a little differently. So I always like to mention this. Okay, the chest pressure, the neck pain, the shoulder pain, it might go down your arm a little bit, but women sometimes will have present with more of like an indigestion or stomach pain, or maybe we're having some pain between the our upper back, between our shoulder blades, or just feeling a little bit of nervous or anxiousness. And so women can actually present very differently. We may not even have the true chest pressure, but you're having like, this indigestion that you don't usually get, this back shoulder pain, maybe a little neck pain. Like, what is this? It sounds very vague, right? And which is why we get dismissed a lot. We'll say, oh, you're probably having your anxiety. Oh, probably a little upset stomach. Take some Pepto Bismol, you'll be fine. No, I want. I'm coming to this emergency room. I need you to work me up. I want to make sure this is not a heart attack because I heard women present differently. So those are some of the subtle things that providers also need to know, because when we do these research studies, it's usually mostly white men are of these research studies. Just now, more recently, they're starting to get more people, more women, more people of color to participate in these studies, so we can really, the findings are generalizable to the public. But I'll just say, not everyone who's having a heart attack feels that chest pressure, like that classic elephant on your chest. So be aware of those subtle symptoms. And I tell people all the time, if something don't feel right to you, something's going on, get it checked out. We'd rather you come and it not be a heart attack than you sitting at home having a heart attack. It's been hours and hours and hours. By the time you come in, there's been so much damage to your heart that we can't reverse it.
Oof. Wow. Thank you so much for that. And again, it's just, I know it's scary, but that's definitely something that we should be aware of, because, again,
Hmm.
once you hit 40, it seems like all the medical problems follow you. Sometimes things that you didn't think would happen,
Yes.
just start popping up once you hit 40 plus. But I've definitely enjoyed this conversation. I know it's been extremely informative. I hope that it does give people who tune in or listen to the audio some confidence on being an advocate for yourself. We are our medical advocate. If someone's not listening to us,
Hmm.
get someone else, but just don't ignore your health, because we know that what the cases are, that sometimes people just simply don't listen to us. But just don't let that be enough to just not take care of yourself. Our health is
Yeah.
extremely important. Before we do end everything, and I would definitely want to thank you again for this wonderful conversation, please let everyone know how they can find you on social media, how they can learn more about you. Just tell everyone all your contact information.
Sure, I make things easy for people because I like, I like to do that. You can visit my website at asknursealice.com. Lots of information. There's some articles on there. It tells you what's going on with me next, where I'm going to be, and other things like that. And then on all socials, and I do respond to my messages, Ask Nurse Alice. So TikTok, Facebook, Instagram, LinkedIn, you name it, I'm on there. Just Ask Nurse Alice, and you'll find me.
Awesome. Thank you so much. Again, I do appreciate this conversation. And I hope that everyone that takes some gems from this conversation just knows that, again, self love is just being, knowing that you're valuable and you're worthy. And I know we talk about self care a lot in the outer and the inner, but we have to really, truly take care of ourselves. We have to live healthier lifestyles. And we do need to make sure we're having those regular checkups. And also mental care, like we mentioned, going to a therapist, but having those primary care physician annual checkups are extremely important. Getting your blood work done. If you're over 40, get your mammograms. If you're males that may tune in, get your prostate check, get your colonoscopy. I definitely had my colonoscopy
Mhm.
last year. get all these things done, because there's so many silent killers out there too that are prevented if there are early prevention care, but we have to go to the doctor in order to get those things checked, to get diagnosed. And again, if you have any feeling ever that you have a doctor that's simply not listening, just assert yourself, find someone else, but just don't give up, because your health is extremely important. So thank you again for tuning into the Key Chat, the conversation amongst queens. Make sure that you take care of yourself and go love yourself.
Della must have did this beat